again, if it affects your life, if you're saying, man, I haven't been able to go walk my dogs more than just down the block for years. Well, again, most of the time there's things that we can do that are simple or conservative that can help alleviate those things and help you enjoy life more.
Hi, everybody. This is Becky Pearson with Pearson Physical Therapy, and I am joined today with Dr. Joshua Wray from North Platte, and he is a podiatrist. Welcome. Dr. Wray, if you could tell us a little bit about yourself and just give us some of your background, we'd love to get to know you better.
Yeah, so I'm a podiatrist located in North Platte. I've been here approximately 5 years practicing in central western Nebraska. I grew up in Idaho, and at first thought I wanted to be a veterinarian, and so I went to school and graduated in animal science and decided partway through that I wanted to get into human medicine. I guess I always knew I wanted to be a doctor or perform medicine, and decided to look at human medicine as I put my vet school on hold, and fell in love with podiatry and the act of getting people to walk better and working with that. And so then I went to podiatry school in Cleveland, Ohio, and did a 3-year surgical residency in New Jersey. When I was in Oklahoma, I had met a friend who, they were both friends, but he married a girl from Burwell, Nebraska. And so he had told me about the Sandhills. And as soon as I'd heard about the Sandhills, I knew it was a place that I wanted to live. And so I spent many study breaks checking the farms of Nebraska for sale, and had set my sights on finding a place to practice pretty much in between Scottsbluff and Grand Island, and it just happened to work out in North Platte. And so then I do some traveling for some satellite clinics. I go to Ord, Lexington, Gothenburg, Cozad, and then obviously see patients here in North Platte as well.
Great. I had no idea. I myself I'm not a Nebraska native. I grew up in Minnesota and fell in love with the Sandhills when I came on a vacation with some friends, and always loved to ride horse. And I just thought the Sandhills were so pretty, and you could just get on your horse and ride forever. So it really is a neat place, and I'm thankful that it's kind of a hidden treasure, if you'd say. A lot of people don't necessarily know how great it is once you get off the interstate, I think.
Oh yes. Everybody goes, oh, you make that drive from east to west and you got Nebraska and it's just, 6 hours of ugliness. And I've never thought that. Especially when he told me what was north of the highway here, I was enthralled, and had done quite a bit of research. And when I first told my wife we wanted to move to Nebraska, she's from Oklahoma, which she's, used to wide open spaces and stuff too. But first she's like, Nebraska, and then she loves it here too. And this is where we hope to stay. So. Great.
Well, we're really glad to have you. So you touched on it a little bit. Why podiatry? Just that goal of getting people to walk more normal. What really has spurred the interest to dive deep into podiatry?
Yeah. So when I had I was accepted to vet school and kind of started feeling uneasy about committing to that. Part of it was I love working with animals, but I didn't really have a desire to work with small animals, and I wanted to own my own horses and cows. And you look at veterinarians, and not many of them have their own horses and cows because they probably get sick of working with everybody else's. But and so I shadowed a bunch of different doctors, and orthopedist, dermatology, family practice, urology, and somebody said, go shadow podiatrist. And my first instinct was, no way. I mean, who would want to do that? And he said, no, go see what he does. And so I did. And I went one day, and I ended up spending a whole month. I went every day for a whole month and spent there. I just was fascinated with all the things. Everybody thinks, oh, it's just feet, but there's so many things out there with your feet. There's diabetes, that affect the feet greatly, and dealing with those complications of wound care, and, keeping people healthy. There's sports medicine. People sprain their ankles all the time or injure themselves that way. There's surgery that can help correct them. There's conservative care, things that you can do to, regenerative medicine with the feet. And I was just amazed at the variety of everything. My first instinct was, a hammer toe and a ingrown toenail, or wart, and that's all it was. It's going to be the same thing every day. And for me, it's not the same thing every day. It's, different things of getting people to enjoy life. Because, again, if you got a hurt tooth or a hurt hand, you can kind of mask those somewhat. But if your foot hurts, you really can't walk, which affects pretty much everything we do in life, whether it's work, play, or enjoying our families or whatever.
And throughout all spectrums of life, we find that when people get older and they can't weight bear and they can't walk, then that affects, so much of their independence and mobility, even down to their ability to stay continent. If they can't walk, then they just have so many more issues. So yeah, hugely, hugely important. Sure. Can someone just come to you without a referral? If their feet are hurting or their ankles, can they just call up your clinic and get in, or do they need a referral from someone?
Yeah, most in Nebraska, most insurances allow you just to come in without a referral. There's probably a very minor, low percentage that may require a referral. Sometimes, like just for instance, the veterans VA type things, usually there needs to be a referral or to come see us. But other than that, most commercial insurances, Medicare, Medicaid, those insurances, you do not need a referral to come see us.
So you touched on this a little bit earlier about regenerative medicine. Are you doing do you have some new advancements? Are you doing some regenerative types of medicine?
Yes. Yeah. The hard part is a lot of that's not covered by insurance and things, but in my residency, I had met a guy who had been working with amniotic membrane more specifically, and a little bit with the PRP, which is the platelet enriched plasma. But so we did a lot of research in our residency on amniotic membrane. And what that is placental tissue from babies that are born healthy. They take all those growth factors and proteins that help produce that baby, and they put it into, there's injectable forms, and there's, solid, more like sheet forms that we use to wrap tendons or nerves during surgery. But more, the regenerative type medicine without doing surgery. We do a lot of injections, where someone who may have an Achilles injury, for instance, their Achilles tendon is injured, and we treat them, conservative for a few months. It's not getting better. And we say, well, let's get an MRI. Let's take a look at this, see if it's actually torn. And you send them, they got a tiny partial tear, but they definitely got something clinically palpable there on their Achilles tendon, or they can feel a bulge on it. And, they're not really, you're like, man, Achilles surgery it's a long recovery. It's a full year. Can I do something that can shorten that? And so we've done, for instance, things like that to do Achilles tendon injections where do that, and we keep them partial weight bearing for a month and then kind of turn them loose. And after about 3 months, they've, a lot of the time feel an improvement and are able to avoid surgery in a lot of cases. I did some of my senior research in my residency on that, and we were able to help a large portion of people avoid having to go through a surgery with all the, pain and rehab and recovery of those kind of things.
Would that benefit someone that has a lot of arthritis in their ankle?
So that's some other things that they're doing with that. Again, our research was very limited with the arthritis. We found more that it helped in tendon surgery and nerve surgery, or more tendon problems, nerve problems, than more in joints. But there are some studies that show that there is a benefit of doing that in ankle joints or big toe joints or things like that. I've done that obviously less to a degree, but in early arthritis, I do think that there is some value in doing those injections.
Yeah. I also did a little bit of reading on like ankle replacement, and had a friend of mine that had a severe ankle injury when he was young, and now he's getting a lot of arthritis in there. And he and I had talked about different stem cell things, or, is he more of a candidate for like an ankle replacement? And I think a lot of times people avoid going necessarily to the doctor because they're afraid of what you guys are going to say, or that you're going to have them go through pretty extensive surgery. Can you give me an idea of what the process is, what you would go through, let's say in his case where he has severe ankle arthritis? I understand you don't have any images in front of you, but what types of things would he go through before you would recommend surgery or like an ankle replacement or something like that?
Yeah. So, first off, obviously looking at x-rays, and when you get to those more moderate to severe changes of the joint, meaning almost bone on bone, kind of that generic term we use. A lot of times we try injections, try bracing, physical therapy to see if that helps alleviate the pain. But a lot of times in those severe joints, those just are going to be Band-Aids and maybe provide a month or 3 months of relief. And then when we decide to do the process, the nice thing now about the ankle replacements, when they started to come out in the 80s, they were only lasting 3 to 5 years. And so you tell a patient that, hey, I'm going to do this major ankle surgery on you, and we're probably going to come back in 3 or 5 years, and you're going to be 6 months of non-weight bearing, kind of bedridden, and we're going to have to do that again. That wasn't very appealing. Well, in probably about 10 years ago, they've really started to make strides in understanding the ankle joint. It's a different joint than a hip or a shoulder or a knee, and taking again some of the things they've learned from those, but incorporating those in the ankle, they've made some good strides where they're lasting now 12 to 15, even 20 years. And, when you do that at 65, that gets someone to 80, and then at that point, you can make a decision there. And they also now have revisional implants, meaning if the original implant wears out, we can come back and put in a second implant that would continue to get ankle joint, range of motion and stuff, as opposed to just an ankle fusion where you would put screws or rods in the ankle to fuse it and it doesn't move. And so, the last few years I was trained in this technology. And so we've done a fair amount here in the last few years since I've come here. And I think it's changed where in residency, I did some ankle joints. I probably was 60% fusion, 40% ankle joint replacement, whereas now I'm probably 80 or 90% ankle joint replacement versus fusion. People do better with them, and those kind of things. And so the process involves, they have this technology now where we can make cutting guides specifically for the patient, which speeds up the surgery, speeds and to a sense makes the implant a little more custom fit for the patient. And so we would get a CT scan, and then they can build these instrumentation for the surgery to help the patient out. And again, I think most patients that have undergone these implants would say they wish they would have done it earlier, or 3 to 5 years earlier. And I've done ankle replacements on anybody from 35 years old to 75 years old. Again, anybody from major car accidents where they have just severe post-traumatic arthritis to people with just osteoarthritis, that wear and tear, or severe gouty arthritis or rheumatoid arthritis, those kind of things. So
would there be precautions, like a hip replacement, they have to avoid, bending over, crossing their legs? Are there, what types of precautions are there with an ankle joint replacement?
Yeah. So no significant precautions after they've, gone through the appropriate rehab and everything. But, initial rehab, it's 4 to 6 weeks of non-weight bearing. I have had a few go 8 weeks with very poor bone quality and things like that. And then after that, it's a protected weight bearing for 4 to 6 weeks. And then usually at that 10 to 12 week mark, it's returning to some activities. Usually the long precautions is, there's not a lot of recommended running or, playing basketball, jumping, those kind of things, but people can return to golfing and biking and, hanging out with the grandkids, those kind of things.
Lower impact type of.
Mm-hmm. Yeah.
Interesting. Huh. Yeah. So we're coming up on, I often say I don't like this season, summer, because of flip-flop season. Yeah. And people will get a lot of foot pain. I guess it's good for business. But what would you, just to give people some tips for general foot health, or general tips in the summer when they are wanting to wear maybe some poor quality footwear? Do you have some general guidelines that you think, if people followed this, they'd have better foot health? What would it be?
Yeah, I think one thing is the 80-20 rule I usually tell people. So, 80% of the time you need to be in a good supportive shoe with, a good heel on it, good support through the arch. and, allowing good movement and a good fitting shoe. And then that allows you, on the weekend or, the 2 hours at the pool to wear some flip flops and, to do that. And so again, I think that'll prevent a lot of problems, with that. Other things recommend is good, lotion and moisture balance, and prevent your skin from getting calluses. And a lot of people that wear flip-flops, because their feet tend to dry out a lot, and they tend to get they get a pressure point and it turns into a callus, and some calluses are not painful and some are very painful. And so doing that, and then just protecting your feet, especially if you have other things that can, comorbidities like diabetes, poor circulation, or peripheral vascular disease, certain arthritises and things, just protecting your feet from cuts and bruises and things like that. People can get a small little sticker and have neuropathy and not feel that. And that can, you've had those that obviously have developed into severe complications requiring amputation, from a small pin or small sticker. One of the most common questions we get is, when should I seek out a podiatrist, professional opinion on pain or thing. And what I tell people is, if pain doesn't usually go away within about 10 to 14 days, then something else is going on besides just a minor sprain or bruise or something like that. And again, if it affects your life, if you're saying, man, I haven't been able to go or walk my dogs more than just down the block for years. Well, again, most of the time there's things that we can do that are simple or conservative that can help alleviate those things and help you enjoy life more. And sometimes it does require surgery, but in most cases there are things that we can do to help people, get back to what they want to do and be able to enjoy life more, and then those kind of things. So.
Yeah, I agree. I think it's wonderful to have this information from you. If people want to visit with you more about this, or they want to consult with you, how can they get a hold of you, or where can they reach out to you at?
Yeah, so they can either call our office at 308-532-3600, and we can make an appointment. Whether, we have 3 podiatrists here in North Platte, and we travel around about a 2-hour radius around North Platte, from Cook or even into Kansas to Ogallala or Ord. And we can, see you there. And that's what I think we love to do, is to meet people locally, where, to provide services so they don't have to do a lot of traveling. And I think that's one thing we offer. And they can also, email us there at our website. They can visit, it's gpfootandankle.com. And they can there's a lot of tips there that they can find some answers and resources. And again, if those aren't helping, they can give us a call and we can help them out.
Great. Wonderful. Well, I really appreciate you joining me today, and I thank you a lot.
Yeah, thank you. Thanks, Becky.